On average, people with hEDS or HSD go undiagnosed for 20 years. And as a hypermobility specialist, I want to do what I can to help shorten that diagnostic delay. So here's a tip I think is really important for anyone looking to be thoroughly evaluated for a hypermobility or a connective tissue disorder. Don't see a rheumatologist. At least, not for hypermobility specifically. And here's why. Generally speaking, rheumatologists are specifically trained to diagnose and treat conditions that are driven primarily by the classical inflammation pathway. Inappropriate activation of this specific inflammatory cascade can lead to an entire cluster of conditions, including lupus, rheumatoid arthritis, sclerosis, Sjogren's, and so many more. Typically, these conditions perpetuate a cycle of classical inflammation, which can then be evaluated through use of blood work as well as imaging of the affected joints. And of course, there are always exceptions, like seronegative cases, for example, but generally speaking, rheumatologists do rely fairly heavily on biomarkers found in blood work to guide their diagnosis and treatment because the conditions they specialize in tend to leave these specific biomarkers behind in the bloodstream where they can be reliably measured. Now, what most people don't know is that there is actually another inflammatory pathway in the body called the neurogenic inflammation pathway. And this is the type of inflammation that drives conditions like hEDS, HSD, MCAS, POTS, CRPS, interstitial cystitis, migraines, and many more. And it can be evaluated with a very careful clinical evaluation alongside specialized testing. But it's next to impossible to detect on standardized lab testing due to how this type of inflammation functions within the body. And even though neurogenic inflammation causes real inflammation and real symptoms, rheumatologists generally aren't trained to diagnose and treat this specific cluster of conditions. And of course, there are always exceptions to this rule of thumb, and generally, it is a good idea to make sure the symptoms aren't being caused by a rheumatologic condition. But I also think many hypermobile patients are somewhat inappropriately sent to rheumatology by well-meaning doctors because they see a patient that has all these joint problems and all these other systemic symptoms and they think, oh, this must be a rheumatologic issue. And then when the rheumatologic evaluation comes back negative, I find that many patients and even physicians aren't really sure what the next step should be. But at least in my experience, there are other types of specialists out there that are more well versed in conditions that are driven by neurogenic inflammation. So rather than relying solely on rheumatology, I would also consider consulting with specialists like PMNR or physiatry, neurology, neuroimmunology, immunology, neuromuscular medicine, medical genetics, interventional pain, or really any specific doctor that's known to be EDS informed within their field.